Hi everyone, I'm Trisha and I'm working here at Exceptional Dentistry at Johns Creek for Dr. Connell, and we've decided to start having a chairside chat. We're going to try to do it about once a month about topics that we find are like trivia with our patients. Everyone wants to have the no or be on the in. I think the best subject matter at this point is going to be bottled water. Did you know that most bottled waters are actually acidic? I know. I can't even begin to think how you can make water acidic, but most brands are bottled in an acidity, which leads to cavities. We're getting a lot more cavities these days doing something we think is healthy. So I just want to give you a little information about why that is. Disease thrives in acidosis. So acid levels make cavities thrive or gingivitis thrive. The bloodstream seeks to maintain a consistent pH balance of 7.3 to 7.4. So acid levels would be lower than that and basic levels would be higher than that. So if you go higher than the balance of pH 7.3, you're at no worries. You actually are doing better for yourself. We want to make sure that you understand that in small doses, anything in moderation is okay. But when you are drinking an acidic beverage, it's basically like liquid cavities. It can seep into nooks and crannies, it can get under the margins of fillings, it gets into the margins of crowns. Generally speaking, your body needs time to be able to recuperate. So when we are in athletics or sports, or we're at an office desk and we're sipping on that water just every few minutes, your actual mouth never gets a chance to remineralize. So you are constantly in an acidic state, and anytime you introduce food into that, you're going to be susceptible for cavities. And generally speaking, what you do currently shows up about 6 to 12 months later. So you may go to a dental appointment and everything's looking fine, you haven't changed anything, and then you come in for your next 6 months and all of a sudden you have 4 cavities and you're going, what? We've got to work at the waters. LaCroix is a very popular drink right now. I like it myself. Again, anything with bubbles is acidic. That's carbonic acid that's added, and though that would make you tip the scales with your enamel. So I need you to do your research. There are these particular wonderful examples on the internet. You can just pull up bottled water pH. I wanted to just go through some of these with you. You can, again, Google bottled water pH levels and you'll get an array of information. On the very left end, you're going to have acidity, and that would be your Propel, which is a 3.5, really acidic, kind of like battery acid. You've got your Aquafina, your Poland Springs, your Dasani, Nestle Pure Life. Fiji is getting to the point where you're at level neutral. You're not basic, you're not acidic, you're neutral. So Fiji would be a better choice. Now, if you're getting into smart water and Volvic, you're about the same. You're right at that level. That Voss, which is VOSS, has been pretty popular out there. Now, when you get into Avion and Icelandic and real water or Eternal or Alkaline 10, you're getting into more of the 8 point, 9 point, and even 10 point, which is basic, which is above and beyond, which actually can actually relay down layers and help you to keep the teeth very strong, your enamel layer strong. So I just thought that that would be really important as we've been having patients come in. We've had our student athletes that are just doing great, eating their vegetables, their fruits, and they're drinking just their sports drinks for their electrolytes to get up there. They're not drinking their pop, beverages, Cokes, and they're thinking they're doing a really good job, and all of a sudden we've had a patient come in with 10 cavities. All he'd been drinking was Propel. So I need everyone just to be a little bit more aware that some things that are healthy for our body are not necessarily healthy for our teeth. I want to leave you guys on a special note. I wanted to read something to you that is in the medical books and is something that's extremely important, I think, to everyone of every age. This is that water can alkalize your body on a cellular level. So it's very important that we are drinking this water, but we just need the right water. If it is a proper balance, it will help you to maintain appropriate bloodstream levels, leads to increased energy, improved sleep, reduces pain, eliminates acid reflux, relieves colitis, it relieves irritable bowel syndrome, it helps to maintain normal weight and blood pressure, all naturally by having an alkalized water system and a cellular system. So everyone get out there and drink the proper water. Our next particular chairside chat we're going to go through will be on some of the more things in drinking, but also in remineralization. We want to help you with some of the old wives' tales, things you can do at home that actually cost nothing more than what you already have to build your enamel back. You only get what you get, but you can make it stronger. Thanks so much for listening.